Hola, muy buenos días a todos. Bienvenidos
Hello,
a...
good morning, everyone. Welcome to this virtual press briefing every week on pandemics because of COVID-19 in the Americas. I work for the communication department in PAHO. Today, we're broadcasting live. We have a simultaneous interpretation into English and into Spanish. You have a button where you have interpretation. You can see the icon down below offers a sound, the floor sound, and then you have Spanish and English. You have the COVID IA, and this session can also be followed through the social networks in PAHO, and you have the different ones. We remind you that the session will last around 45 minutes, and we will take questions until the end of this virtual press briefing. The director, Dr. Carissa Etienne, will report on the current situation of the pandemic in the region and on the impact that this is having on populations in situation of poverty and in the most vulnerable groups. We have Jarbas Barabosa, Assistant Director of PAHO, Ciro Ugarte, Director of the Emergencies, Health Emergencies, Marcos Espinal, the Director of Communicable Diseases, and Silvan Alighieri, Assistant Director of Emergency and Incident Manager for COVID-19. So now I'd like to give the floor to Dr. Etienne for her opening statement. Dr. Etienne,
Thank you,
please.
Sebastian. Welcome, and thank you for joining us. As of May 18th, there have been more than 2 million cases and more than 121,000 deaths due to COVID-19 reported in the Americas. This represents a startling increase of 14% for cases and for deaths from just last week. As the curve of the pandemic flattens or falls in other parts of the world, the virus is surging across our region. We are increasingly worried about the poor and other vulnerable groups at greatest risk of illness and death from the virus. The recent spike in cases and fatalities is partly due to the virus taking root in these groups. This includes indigenous groups living in the Amazon basin, which is home to over 2,400 indigenous territories across 8 countries. These groups live in both isolated villages with minimal access to health services or in densely populated cities, such as Manaus, Iquitos, and Leticia. We have already confirmed 20,000 cases of COVID-19 in the provinces that form the Amazon basin, where the incidence tends to be twice as high as compared to other states in the same countries. Without immediate action, these communities will face a disproportionate impact. If we want to slow the spread of the pandemic and put our region on a path to recovery, we must protect vulnerable groups from COVID-19. We must work together unrelentingly and with great speed to provide the resources and support that they need to fight the virus. Last week, I warned that COVID-19 has forced us to address 3 different but interrelated emergencies: economic, social, and health emergencies. Protecting vulnerable groups is central to addressing each of these. Our region is home to high rates of inequality, with many communities disproportionately affected by poverty and ranking low on the Human Development Index, even within middle-income countries. These communities struggle to access adequate health services and sanitation. We are also a highly urbanized region, with many people living in dense neighborhoods. Poor social and economic conditions provide a fertile breeding ground for COVID-19. And it is no surprise, therefore, that these communities are among the hardest hit by the pandemic. They are also less resistant to the economic shocks of parents being out of work and children being out of school. I also want to highlight a few specific groups that are at great risk due to social barriers and thus require specific policies to protect them. Women. Women are disproportionately affected by health crises, and this pandemic has been no different. Women in our region face income disparity, lack of adequate access to health services, and are often subject to gender-based violence. In addition, women make up 70% of the health workforce in the Americas. So that is to say that they are on the front lines of COVID-19 and are disproportionately affected. People of African descent in Latin America struggle to access appropriate care in normal circumstances, a reflection of structural discrimination and racial inequity. These conditions put them at greater danger of contracting COVID-19, and they face the most severe consequences of the disease. Indigenous populations, as I mentioned before, face high rates of food insecurity, type 2 diabetes, and are affected by endemic diseases such as TB and malaria, which make them more likely to suffer the burden of this pandemic. When they live in isolation or remote areas, they face challenges from the interactions with non-Indigenous groups who may be carriers for COVID-19 and other diseases, and at the same time will struggle to access health services in both small villages and large cities. COVID-19 is spreading rapidly through our prisons, where overcrowding and poor sanitation make it difficult for prisoners to protect themselves from the virus. The same is true for migrants living in temporary settlements or in the process of migrating, where access to healthcare services is very often limited. Lastly, people with underlying health conditions are particularly susceptible to hospitalization, severe illness, and death due to COVID-19. Unfortunately, almost 221 million people in our region are at increased risk because they have an underlying condition, including people with non-communicable diseases such as cardiovascular diseases, obesity, and diabetes. These groups are not only vulnerable to the virus, but will face disruptions in treatment and care for otherwise manageable diseases due to the overwhelming of health systems. Protecting vulnerable groups is critical to addressing the health, social, and economic emergencies and winning the fight against COVID-19. It's necessary because we can't stop the spread of the virus if we don't focus on all those affected by it, including vulnerable population. It's also our responsibility because everyone has the right to health, to access testing, treatment, and care, regardless of who they are or where they live. First, we need to improve access to the public health measures that we know are effective, and we need to implement them aggressively, especially in areas with a higher risk of transmission. PAHO has issued clear guidance for countries on what works and should be done in each setting. And our teams are actively supporting implementation throughout the region. Second, all countries must strengthen health system capacity to better serve vulnerable communities. During a pandemic, we must overcome the structural inequalities that limit access to services. This means establishing mechanisms that support universal access to health, regardless of income, pooling of resources with the private and not-for-profit sector, eliminating payment at point of service, and setting up emergency hospitals that add surge capacity where it is most needed. These measures will not only improve access to health services today, but will lay the groundwork for faster, more equitable delivery of health innovations tomorrow, including new tests, treatments, and a future vaccine for COVID-19. Third, we must institute strong social and economic protections to safeguard the most vulnerable. With school closures, rising unemployment, and a slowdown of the informal economy, many are struggling to make ends meet during the pandemic. Our region has good examples of successful social protection programs, and we should be using them extensively at this unprecedented time. Far too often, we fail to prioritize the health and well-being of the most vulnerable among us. This must change if we want to stop the spread of COVID-19 and at the same time be ready to face future pandemics. It is only by ensuring human rights for all, when all peoples have universal access to health and its socioeconomic determinants, when we guarantee social protection for the vulnerable, and when our economic development addresses the eradication of poverty and the achievement of the Sustainable Development Goals, only then will the world be prepared to face future pandemics. But we need to begin this work now. Thank you.
Muchas gracias, doctora Etienne. Vamos a comenzar ahora con las preguntas que hemos recibido por correo electrónico y luego pasaremos a preguntas del chat.
We will begin with the questions that we've received through email, and then we will turn to the questions that we've received over the chat. So you can write your questions, and we will take these and reply to these. And we please ask you that you give us your name and the media you represent when you ask your questions. First question, then, from Guillermo Garcia from the FA agency. In English, he asks,
The US pulled his funding to the WHO and now is threatening to do it permanently. How is this impacting the PAHO work during this pandemic, and which could be the impact for PAHO if the US stops sending funding to the WHO permanently? Doctora Etienne?
Thank you for this question. PAHO hopes that we will continue collaboration with the United States and all of our other allies. As I said before, governments of the Americas formed PAHO in 1902 in response to disease outbreaks, infectious diseases like malaria and yellow fever, which were interrupting trade. It is important to note that the US was a founding member of PAHO. When WHO was formed, the countries of the Americas decided to maintain this unique identity of PAHO, while at the same time agreeing to serve as the WHO Regional Office for the Americas. Some 60% of PAHO's assessed contributions comes from the US. And this has allowed us to support a range of public health programs, to address vaccination programs, and to work together to confront communicable diseases like malaria, TB, and HIV/AIDS, and to fight outbreaks like measles, yellow fever, dengue, Zika, and now COVID-19. This mutual collaboration with the US has advanced through the years, and we do look forward to our future collaboration. Let me also take this opportunity to tell you about how early PAHO has reacted and responded to COVID-19 in the Americas. Our agility in the face of outbreaks has been built over time. On the 2nd of January, we received an email to all WHO IHR focal points from WHO headquarters, which listed the cluster of pneumonia of unknown origin reported by WHO China office. On January 5th and 12th, under the IHR requirements, WHO headquarters shared the information with all WHO member states. On January 16th, PAHO issued an epidemiological alert to all of member states of PAHO, with information about COVID-19 and recommendations for member states. On January 24th, in my capacity as director of PAHO, I sent a letter to all ministers and secretaries of health and high officials, sharing key considerations and information regarding the emergence and spread of the new coronavirus that was circulating in China and the important implications for the Americas. On January 28, I declared an internal disaster, activating all PAHO's emergency procedures, reprogrammed funds, activated all country offices' response plans, expedited needs assessment, and prioritized technical cooperation for country readiness. We organized technical missions to countries, supported member states to update pandemic response plans. We developed and applied a modeling guide for planning purposes and provided lab test kits, swabs, and probes, and trained lab staff. We also trained frontline staff, including health personnel, and we held risk communication workshops. Since then, we have distributed PPEs, personal protective equipment, and other equipment, lab tests for 3 million reactions. We've issued numerous guidelines, technical briefs, and held many webinars. And all our country offices are working with member states in Latin America and the Caribbean to plan, implement, and support the response in every country. This is supported by our headquarters in Washington and WHO in Geneva. All of this costs money, and we rely on our donors to help us, including the United States of America. So let me just reiterate that we are all in this together, and it is only together that we will achieve success. And I do look forward to continuing our work with all member states during this pandemic and beyond. Thanks.
Gracias, doctora Etienne. La siguiente pregunta nos llega de
Thank you,
Sara.
Dr. Etienne. The next one is Sara Molares, and it reads as follows. Mexico just contributed 1 million euros in order to join an international team headed by the UN and the European Union, who attempts to develop the vaccine against the new coronavirus. How do you see the possibilities of the most vulnerable countries in the region to get the future vaccine? And what difficulties do you currently encounter to have access to supplies, drugs, and tests in order to deal with the pandemic in the respective public health systems, besides what PAHO is doing? Dr. Barbosa, please. Thank you for that question. Countries in Latin America and the Caribbean have a very important role to play. And Mexico, as has been said, has even proposed a resolution before the United Nations. The president of Costa Rica is also one of the leaders in this global movement in order to ensure equitable access to vaccines, to medicines, to all the necessary essential tools in order to respond to COVID-19. We currently have more than 100 projects working on the vaccine. Some have already begun tests in humans. Some have already completed phase 1 of the assays and the trials in phase 1. So maybe global cooperation, if you can take this as a sign, a vaccine could be ready in 1 year in order to be ready to be manufactured. PAHO has worked with international partners on the issue of the vaccine in order to ensure and guarantee that countries in the region will have access to the vaccine as soon as it is available. We cannot allow access to the vaccine to be related or linked to the payment capacity of a country. It is extremely important as one of the pillars of our organization, solidarity, and to make sure that everyone has access to this vaccine whenever it is ready. So it is important to see what Mexico is doing and all the countries in this region. Thank you. Thank you very much, Doctor. The next question from Laura Sepulveda from the Voice of America, and she says, Yale University in a study stated that there are poor countries that have adopted the crisis management model of rich countries, which really strikes hard in their economy. According to the view of PAHO, Are we having an adequate management of the crisis in the region? Could this be better managed in a second wave of this virus? Dr. Espinal, please. Thank you very much for the question, Laura. PAHO believes that the region is taking the necessary steps in order to manage the crisis. There's always room for improvement, and there are countries that have different models. This model does not apply to all countries because we have high-income countries, middle-income countries, and low-income countries. We have to understand, and this is very clear, that some of the measures are more difficult to enforce in poorer countries. It is not the same thing to have social distancing in neighborhoods or in clusters or in slums where people live in isolated fashion in some cases. So it is important that measures be taken. But in order to do that, countries have implemented different measures. Some have implemented partial quarantines. We have health shelters at home in different cities. So it is important to clarify that the measures recommended by PAHO and by WHO are measures that are applicable and that can be adapted to all countries of the world. Education measures such as hand washing, social distancing measure. We have to recall that all society, the entire society must be part of this. So every country adopts its model, and for that, PAHO provides advice and is in constant communication through its experts throughout the entire day and during 7 days a week. Thank you. Thank you very much, Doctor. The next question comes from Ana Vargas, Central Matters, Central Issues in Bolivia, and Valentina de Marval, AFP. And they wrote about the following issues. In Bolivia, there's a boom in the use of drugs and medicines. There are pharmacies and drugstores manufacturing this for human consumption. Do you have any advice for the use of these drugs, these medicines? Dr. Alighieri, please. Thank you for the question. Ivermectin is used as an anti-parasitic drug. In the region of the Americas, it has been used in campaigns in order to eliminate these diseases, too, onchocerciasis and filariasis, lymphatic filariasis. We are obviously aware of this, and we're following this closely. The studies underway with this drug, and we're publishing on a regular fashion scientific reviews on the web. Today, that is to say May 15th, the last update that we published on our webpage, we have not detected in all articles published any benefit as a negative impact on these studies. So this means that currently it is not only the drug, this is not a drug that we're recommending as a first line or top line treatment for COVID-19. However, countries and scientists can get together, they can bring together studies, research studies, such as the Solidarity Study, and to integrate or to bring in patients in groups, study groups, a clinical study group, random studies in conditions of hospitalization. And that is a principle that applies to all new therapeutics and new treatments that are being tested and tried at a global as well as at a regional level. Thank you. Thank you, Doctor. We now move on to the next question that we received from Yvette Munguia, El Confidencial from Nicaragua, and also Lidia Lopez from La Prensa from Nicaragua. And they say that 5 former ministers of health of Nicaragua, 600 physicians of the Costa Rica Congress have asked PAHO to act before what they mentioned, the negligence of the state of Nicaragua before COVID-19. What is the response of PAHO? That is a question. And they also mention the accusation of hiding data and facts. Did PAHO have a mechanism in order to demand the state to be stricter in their reports? And what can PAHO do when faced with this situation? Dr. Ugarte, please. Thank you very much for the question. It is very important to learn about the situation of the pandemic in all countries in the region and in the world. The government of Nicaragua was in contact with PAHO 1 week ago, saying that they would meet their responsibility in order to report on the situation and the status of the pandemic according to the IHR. They also said that they would allow to have visits to health establishments and that they would provide detailed information on the cases and the number of deaths, confirmed and suspicious cases, and details of gender, age, and location. To date, none of these actions have materialized, in spite of the reiterated request by PAHO. In that context, and taking into account non-official reports on the increase in the number of cases of deaths and pneumonias, PAHO has renewed its commitment to support the government of Nicaragua in order to reduce the impact on the population, and has also continued renewing and reiterating its recommendations in writing and orally. In that regard, we believe that we can analyze the situation in the country. We can provide a better cooperation. In the meantime, the recommendations that were submitted over a month ago continue in force. Thank you. Thank you, Dr. Ugarte. We will now attempt to give the floor to a journalist over the chat so that they can address a question directly. And that is Barbara Fraser, who contributes with Enlace and other means of communication. Barbara, can you hear us? You can address your question.
Good morning. Thank you very much. I have actually sort of two questions in one. One is countries like Peru. There are some countries, including Peru, that are using antibody tests more than PCR tests as part of their case identification. In Peru, the ratio is approximately 1 PCR test to 5 antibody tests. I'd like to know how that affects the actual case, the understanding of the progression of the epidemic in the country when so many of the tests are rapid tests instead of PCR. And then once the country begins to lift the lockdown and open up again to economic activity, what kind of surveillance should be in place? What are the recommendations that you have about doing surveillance? How should it be done? Case tracking? How should countries prepare for case tracking and surveillance? Thank you.
Gracias, Bárbara. Doctor Barbosa, ¿puede tomar esta pregunta de Bárbara?
Thank you, Barbara. Dr. Barbosa, could you please answer this question by Barbara?
Thank you for this question. Barbara, the recommendation is that we need to use the PCR tests to confirm or discard the case. And the reason for this is that with PCR, we have almost 100% of sensitivity and specificity. With antibodies tests, if we use them to confirm a case, some antibody tests can reach up to 75% of a false negative. And this is easy to understand. The human body will take some days to produce antibodies that will be detected for these tests. For these reasons, it's very important to use the PCR test. We know that many countries have faced difficulties to access these tests. The Pan American Health Organization, using international solidarity and donation and our emergency funds, has deployed more than 2 million tests to the countries in the Americas. We are also using our strategic fund, that is a regional purchasing mechanism, to purchase the tests. We have deployed also more than 2.5 million tests, PCR tests to the countries. So it's important to increase the access because, as you mentioned in your question, we need numbers that can be compared. If we have a positive case to a PCR test, it is totally compared to another positive case in the same condition. So we believe that with this effort from the countries, including Peru, to have more access to PCR tests, we can reduce the use of antibody tests and let them to seroepidemiological studies that are also important to be performed in the countries to have measurements about what is the proportion of the population that have had contact with COVID-19. Thank you.
Gracias, doctor. La siguiente pregunta
Thank you,
le vamos
doctor. And the next question, we're going to give the floor through the chat to Ariel Bowled from Tritium.
Good morning. My question is related to hurricane season. It's mid-May and hurricane season is approaching June 1st. Is there a fear that there will be an increase in cases or a outbreak as with when a hurricane happens, people go to shelters in their close proximity, which can cause COVID-19 to be more contagious? And what recommendation and modifications will countries need to be making in their hurricane preparedness plan to manage the crisis and reducing the level of infections?
Muy bien, gracias por la pregunta.
Very well, thank you for the question. Dr. Ugarte, can you take that question?
Thank you for the question. Yes, hurricane season is approaching. And of course, hurricane season will present additional challenges particularly for the Caribbean countries. And our recommendations have been published through a document regarding hurricane provisions for shelters in the times of COVID-19. Basically, what we want to ensure is that the people and the communities and the governments update their plans, adjust their plans to the current situation, and maintaining the social distancing and other protective measures, also ensuring that the health services are fully operational so they can cope both with COVID-19 and the potential impacts of the hurricane season. We have to recognize that there are certain populations that, as the director mentioned, vulnerable populations inside the countries that need to be prioritized, including people with disabilities and others that may not be able to respond adequately in times of social distancing. And when a hurricane season comes, they may be more in danger, or they may need additional specific response. So with that, in that regards, the hurricane season is a situation that the countries also may highlight through the inter-sectoral mechanisms that are, I'm sure, active for COVID-19 in all the countries in the Caribbean. Thank you.
Gracias, doctor. Siguiente.
Thank you, doctor. Our next question also coming through the chat and by mail from Anthony Boyle from Reuters News, senior correspondent in Brasilia, and it's in English.
PAHO's position on the wider use of hydroxychloroquine in this pandemic, as the Brazilian government is planning to prescribe. Dr. Espinal, can you take this question?
Thank you, Anthony, for this question, a very important one. PAHO's position is that there is no evidence to recommend hydroxychloroquine and chloroquine for use in COVID-19. We don't have yet results of clinical trials that suggest the efficacy of these two medicines. And in fact, from the very beginning, as the director mentioned, the PAHO was engaged with the countries since January. PAHO immediately produced a very thorough, systematic review about the evidence on these two drugs. And we just updated the document, and still there is no evidence to suggest that these two drugs are efficacious against COVID-19. The use in any country, it's a matter of the country deciding, but our recommendations are crystal clear that they should not be used yet. And in fact, current studies are suggesting high rate of secondary effects and cardiac cardiology problems in people who are using. Thank you very much.
Gracias, doctor. Siguiente
Thank you,
pregunta.
doctor. The next question comes from our colleagues from Geneva, from Jamil Chadet from Brazil, and a similar question from Roberto Almeida from the Social and Environmental Institute. It's a question in English.
The situation of the indigenous populations in the Amazon. Is PAHO discussing the possibility of classifying indigenous communities as a specific risk group in relation to COVID-19 pandemic? Dr. Aldigueri?
Thank you for these two questions. So I will try to answer both in the same manner. Of course, as Dr. Etienne flagged during her remarks, we are talking about vulnerable population. We are talking about indigenous people, not only in the Amazon basin, but also in the highlands of the Andes, also in Central America. But also we are talking about Afro-descendants minorities in countries of Latin America, and also in the interior of the countries of the Guyanese Shield, as Suriname and French Guiana. These are very vulnerable population for different reasons. One of the first reasons is the challenge in terms of health promotion, in terms of community engagement that are triggered by the cultural barriers. So this population need special communication regarding the prevention and the implementation of public health measures. This is one aspect. The second aspect, which is complex, is that indigenous people are also living in big cities, and there are big cities in the Amazon basin. We are thinking about Manaus in Brazil, Leticia in Colombia, Iquitos in Peru, and many other places. And this population, in addition to have these challenges in terms of health promotion, accessing the information, are also living in poverty, very dense neighborhood, and also with comorbidities. And among this population in these big cities, there is a risk of amplification of the virus, and after a spread to the remote communities through the rivers and through the highways in the Amazon. At this moment, we have different red flags, hotspots. I'd like to flag, if I may, the tree border area between Brazil, Colombia, and Peru. But also, and in these areas, we are seeing the trends up with a high reproductive rate of the COVID spread. But also, we would like to flag other areas that are emerging during the last days and weeks in border areas between Brazil, French Guiana, and Suriname. So we must be in alert. We must consider these indigenous groups as vulnerable population and implement specific prevention and control measures to protect them from high burden of this disease. Thank you.
Gracias, doctor.
Thank you, doctor. We have several questions related to Mexico. I'm going to ask them in two sections. Ana Cortella from the Financiero Bloomberg in Mexico asks that Mexico already presented its gradual lockdown, indicating what regions in the country can start up the operations based on the level of contagion. What does PAHO think about that plan, and what are the parameter, criteria, data, or key figures to be taken into consideration when deciding de-lockdown in one section or part of the country? David Garcia from Thomson Reuters also asks the same. What does PAHO think about the Mexican government's decision to gradually reopen their economy? He says that despite the scarcity of tests for COVID and no downward trend of new cases. Dr. Barbosa, thank you. Thank you for that question. I believe that all countries are currently reviewing the situation of the transmission and their plans for the future. There is no single recipe for all countries. We have to think, what's the objective when the social distancing measures are adopted, which is to reduce the speed of the transmission so that the number of severe cases produced every day don't exceed the health service capacity. That's the main reason for these social distancing measures. So to respond as to whether a stronger or more relaxed measures should be adopted, we'd have to consider an answer of one question. What's the transmission like? Has the transmission been controlled? Do they have sufficient tests to test all suspicious cases and control the contacts? If we see a decrease in the number of cases consistently for a given period of time, which has to be monitored very carefully, as is being done in many cases and in Mexico as well, because often in a country, the situation may be different in a province or in a municipality. So that has to be taken into consideration. If there is guarantee that there's control of the transmission, they should begin with a planned and careful process, carefully and closely monitoring some of the indicators. The first, the dynamic of the transmission itself. If certain measures are adopted, like, for example, returning to classrooms, and they perceive an increase in the number of cases, then they have to review what's happening. And if necessary, maybe even take one step back again. So it has to be carefully planned, taking into consideration the most important measures to reduce the burden on the poor families, on the economy, but in a very carefully planned way, monitoring what's actually happening. Some countries in Europe who began the transmission before Latin America began this process, and we're learning from their experience. We know that a careful plan done very cautiously, monitoring the transmission on the one hand, and on the other, checking what the ICU and hospital beds are like, and the respirators is very important. It has to be done every day in each country so that they can actually very carefully and very well balanced plan the opening to reduce the transmission, to allow for treatment of severe cases in the hospitals in the transition process. Thank you very much. Thank you, doctor. The next question in the chat comes from Jerry Diaz from Catholic Media in Guyana, who asks,
smaller countries in the Caribbean could be affected due to not getting essential supplies of testing kits, other essential medical and sanitizing supplies due to restrictions on exports from the USA and Europe. How are you able to give this priority for us in the Caribbean? Doctor Ugarte, ¿puede tomar esta pregunta?
Yes, we've been working very closely with the Caribbean agencies to ensure that the essential supplies arrive to the countries in need. Actually, we've been able to channel a lot of those supplies from other sources to the Caribbean countries. We understand that there are still several challenges, and we work very closely with the global supply chain of WHO and other UN agencies. And the Caribbean is one of the areas of the Americas that have been prioritized. And also, we recently signed an agreement with a security system in the Caribbean, so to be able to transport of those essential supplies and also to have a hub in Panama, so we can also distribute from Panama to the Caribbean and other countries in the Americas. Most of the tests have been supplied by PAHO directly through our procurement channels and also using the strategic fund, that is the fund that PAHO has to purchase medicines and essential supplies in the Americas. Thank you.
Gracias, doctor.
Thank you, doctor. The next question is sort of interrelated. Jacqueline Charles from the Miami Herald asks,
does PAHO know how many incidents of discrimination and stigma that has taken place in the region, and how is it impacting the response? Any places you are deeply troubled by? Pregunta Jacqueline Charles. Doctor Espinal puede
asked
tomar
by Jacqueline Charles. Dr. Espinal, can you take that question?
Thank you for the question. This is a very important question because the concern is generalized. It applies to everyone. We have seen stigma in the pandemic earlier, actually, in some population groups. So it is important that education and the facts are shared with the population so they are well informed on what is not a fake news and what is a fact news. I think the issue of stigma has also a lot to do with populations living in conditions of vulnerability, and the director mentioned some of them already. PAHO just it's advising countries and just issue a very comprehensive set of guidelines on human rights, gender issues, and ethnicity. And this document is available to all the countries. I think it is important that countries not only rely that because people who are going to be more stigmatized, not only population groups, but all those who suffer of COVID sometimes, and we have seen that. So the message is COVID doesn't has privilege to anybody. It could affect anyone, and it's a disease. So stigma is out of the question, and we recommend countries to work with us to ensure that the proper advice and the proper education programs based on the advice we give on ethnicity, gender, human rights, and key facts are spread among the population so they are well informed and ready to ensure that stigma is not a problem. But it's always there is a risk, and we need to watch carefully on this issue to prevent population groups being stigmatized and people affected by COVID. Thank you.
Gracias, doctor. Siguiente pregunta.
Thank you, doctor. And the next question in the chat comes from Melina Ochoa from Uno Noticias TV. She asked several, but one of the questions is, what do you think of countries of the region in the Americas using the so-called the herd immunity against COVID-19? Does it work, Dr. Alighieri? Thank you. That is an interesting question. Definitely, the herd immunity is not the strategy that's being recommended by the World Health Organization, nor by us. The axis and the response strategy are based on detection of cases, on isolation of cases, on identification of contacts, quarantine of contacts, clinical management to save lives of cases, and the implementation of the public health measures with all the different stages. That is the road we must follow in the region. It's not to look for the herd immunity, which in fact are words we don't like and don't actually apply to human beings. Thank you. Thank you, doctor. This question comes from Manuela Andreoni from the New York Times, who says in English,
local officials have been finding it hard to convince people that they should stay home. What advice does PAHO have for those officials? Quizás doctor Espinal puede tomar esta pregunta.
Thank you. Yes, the
Pinar,
advantage
please.
is to have
Sí,
consistent messages to inform the population and the people. But when the messages are not consistent and different, then there is a problem and people don't know where to go or what to accept. And it is important that countries make their message consistent with the recommendations of international experts based in PAHO and based in WHO. The policy of these two institutions are very clear, and my colleague Dr. Aldiger just mentioned about the how to address the epidemic. If we recommend non-pharmaceutical measures like social distance, well, social distance needs to be implemented. It doesn't need to be social distance 24 hours or curfews of 24 hours. Countries use different approaches, but the messages are very important. And if in countries where there are no consistencies, it is that remains a problem, and it's a problem that needs to be addressed because it means more cases and it means potentially, as we are seeing, more death. So we keep recommending consistency, risk communication according to international standards, and the whole package of that PAHO recommends for addressing the epidemic to be implemented. Thank you very much.
Gracias, doctor. Vamos a.
Thank you, doctor. We're almost coming to the end of this session, so we're going to go to the last question coming from Rodrigo Caetano from Exam, Brazil, who asks in English.
COVID-19 revealed the necessity of a universal health system for all countries. How to create such system and how to balance public and private interests regarding the health market. Dr. Etienne?
Thank you for this question. I agree with you that the COVID-19 pandemic has reinforced the urgency with which we must strengthen and transform health systems to achieve universal health coverage and universal access to health. Emergency preparedness and response will only be effective if our health systems have the capacity to address the needs of all, and especially the most vulnerable within our societies. An emergency response can only be built on a system that is adaptive and responsive to the needs of all, where barriers to access, be they financial, cultural, or geographical, have been eliminated, and where primary healthcare is and has been the foundation on which the health system has been built. In the Americas, our health systems remain highly segmented and fragmented, impacting access to healthcare in normal times, and therefore impacting the emergency response in times of a pandemic. Our health systems have not received the financing that is necessary to ensure universal health within the region. And financing must be solidarity-based and must protect people from catastrophic expenditures and impoverishment. Poorly organized, poorly financed health systems in normal times will never have the capacity to respond to an emergency, impacting the outcomes of the emergency response and contributing to increased levels of vulnerability within society. And so, as we respond to the immediate needs of the pandemic, we must be conscious of the need to reset policy, to transform our health systems and our social protection mechanisms to ensure universal health and social protection, and build resilience within our health systems and societies as we move forward. We must do so with an equity lens, addressing the needs of our most vulnerable populations. I need to say that we all have a role to play in this: academia, civil society, and the private sector, the media as well. However, it is the role of the state to provide leadership and stewardship in the transformation of our health systems and our social protection mechanisms. and to regulate the necessary processes, institutions, and sectors, including the private sector, to support the objectives of the transformation towards universal health. This is a priority for PAHO, and we will continue to provide support to governments in this key area of health systems transformation within the context of COVID-19 and beyond. Thank you for this question. It's together that we will overcome. Thank you.
Gracias, doctora Etienne. Ahora sí, entonces.
Thank you, Dr. Etienne. We have now come to the end of this session. We will be sending the opening words of the director as well as the recording of the session via email to all of you. And you can continue in contact with us via email. We will be answering soon. Thank you all, and we'll keep in touch. Thank you.